Hello, this is Chris Pickard at Body Imbalance in Hertfordshire, and today I'm going to be talking about hormone problems, sexual related issues for women, and pelvic pain. But the shocker is that I'm going to tell you about, first of all, a story from a book called You Can Fix Your Brain. And you might think, well, what has your brain got to do with pelvic pain? I mean, you might think, yeah, okay, hormone issues might be coming from the brain, but the brain does, after all, control everything. But here's the story, first of all, and then I'm going to tell you about some typical things that happen in the clinic and why it's a good idea, no matter what problem you have, to get your spine checked or your pelvis. Okay, so this is a story, and you can actually go and download this from a website, thedoctor.com, so just THEDR, thedoctor.com/study. Okay, so it's about a girl who, when she was, I think, 19, she started getting pelvic pain on her right side, and then it started to go across to the left. Now, the doctor, because of where it started, thought it was an appendix problem, so he referred her to have surgery. She had her appendix out, didn't make any difference at all. And in fact, over the next few years, things started to develop further. She then started to get menstrual pain, I think increased bleeding, pain. She started to get bowel issues and constant diarrhea. So the next diagnosis was she's got IBS and it's caused by stress. But the only stress were all these symptoms that were coming. And then a few more years go by and she starts getting recurrent bladder and vaginal infections, and she has lots of antibiotics. It causes temporary relief of the problem for a while, but it just keeps on getting worse. Doctors then give her estrogen replacement, even though she's young. They give her extra estrogen, no significant help. Then she has a baby. While she's pregnant, she gets back pain. And then I think during this time, she then has a pregnancy, but then it's a spontaneous abortion. Then she has a premature baby. But I think during this time, she also started to lose feeling around her vagina, started getting poor bladder function as well. And so the doctors did some investigative surgery, didn't find what was wrong, but they thought, you know what, let's just cut something out. Let's have a partial hysterectomy. She had a partial hysterectomy. I think that helped some of the symptoms, but it certainly didn't help the bladder control, certainly didn't help the feeling around the vagina, didn't change the pelvic pain, didn't change just most of the problems were still there. And then it was after the hysterectomy that she finally went to a chiropractor. Now, she didn't have any back pain, it was pelvic pain, it was pain at the front, but she went to a chiropractor, and the chiropractor found a problem at the base of her spine, and he started working on that. And I think he saw her a couple of times a week for 4 weeks, and after 4 weeks, 25 years of pain had gone. Not only had the pain gone, but all of our other symptoms started improving. Her infections, after about 3 months, her infections had gone. She got complete feeling back so she could actually enjoy sex with her husband again. Bladder control had come back within 4 weeks as well. And these are the sorts of things that are not equated with seeing a chiropractor or seeing an osteopath, seeing someone to see your back. When there's no symptoms in the back, there are all kinds of other symptoms. But here's the other thing in the history that was absolutely critical. And if someone had actually picked up on this at the beginning and said, sounds like you had a mechanical problem, you should see a chiropractor. Before the pain in the pelvis started, she had fallen down the stairs. Now, she didn't have any pain at the time, but the fall down the stairs almost certainly twisted her pelvis and her lower back, and it started to cause problems somewhere else, not in her back, but at the front of her spine. And this is something that I've seen many, many times at the clinic. I have seen women who have been infertile, unable to conceive. I have seen women with incredible menstrual problems. I have seen women going through terrible early menopausal symptoms. And when they come in with back pain and we work on the back, so many times these problems resolve. There have been a number of women who have been able to conceive, not just by actually having their back checked and looked at. It's not the cause 100% of the time. The spine isn't the cause of all these problems 100% of the time. But I estimate that about a third of a lot of problems that are put down to hormone problems or something else is actually coming from the spine. And there's actually a study on spinal manipulation and infertility showing that it is actually a third of the time infertility is coming from a mechanical problem in the spine and the pelvis. You get the mechanics right, suddenly the internal environment, there's spacious, there's room enough to have a baby and you'll conceive, or there's pressure taken off of the tubes, or something happens. So please, if you know someone who is having hormonal havoc or is having problems in the pelvic region, and they have not seen a chiropractor or an osteopath or a physiotherapist, someone that's going to really get mechanically into the area, then please tell them, or please share this video with them and say it might be a good idea to actually get this checked before you spend thousands and thousands of pounds, or before you have surgery, before you have this, try this, because it might just be the answer. Okay, thank you very much for watching. As ever, be well, and if you'd like to give us a ring at the clinic, bodyimbalanceuk.com. The phone number is 01707 662 704. Thank you.